It's important to know that while we have guidelines, okay, guidelines, especially in this country, are meant to take care and do the right thing for the largest number of people, but it's also with the littlest use of resources. And that's the truth. The truth is you have to be in tune with your body and you realize that you are not the statistic. You are not necessarily going to fit into, well, I don't have to have a colonoscopy yet because I'm not 50, even though my bowel habits have changed, even though I'm having a lot of blood when I have a bowel movement. That's why it's important for you to actually educate yourself and be your own healthcare advocate. And that's something that I think is really important. You should leave each doctor's appointment with a plan. So if I, as a 40-year-old, I come into a doctor's office, I say, I'm having rectal bleeding, this is new for me. The doctor says, you know what, it's probably hemorrhoids. First of all, I think, did they examine me? And a lot of times, especially a male, you're actually happy that they didn't examine you, but that's not necessarily the right thing to do. They'll write you for some medication for your hemorrhoids. If they say come back in 6 months, my argument with that, or not even an argument, my plan would be, hey doc, I would prefer to see whether or not this treatment you have works, but let me come back in a month. If it's not working in a month, what would the next step be? And the doctor should be able to tell you, well, if it's not working in a month, then I would do this. And if that still doesn't lead to a colonoscopy, it's, well, what would that be? Well, I try this medicine. And then I would say, well, when would you send me to a specialist, doc? Or when would we rule this out if it did not work in this amount of time? But every appointment you leave as a patient, there should be a plan for what the doc is gonna do for you. And if that doesn't work, what the next plan is. And I think that that's totally fair. And me as a health professional, that's what I do for all of my patients.